Factory Studios in downtown Little Rock. This is Capitol View.
Welcome to Capitol View. I'm your host, Roby Brock. In Washington, D.C., there are plenty of policy decisions in flux over Medicaid, SNAP, healthcare in general. Joining me now is Keesa Smith-Brantley, Executive Director of Arkansas Advocates for Children and Families. Welcome. Always good to see you.
Always great to see you, Roby.
Do we have anything to talk about?
I think a couple of things,
just
right?
a tad. All right. Generally speaking, Medicaid cuts, in your estimation, and I believe everybody's estimation, is going to be bad for the state of Arkansas, bad for hospitals. There are things that could be done to improve that program for its longevity, and that is the argument we're hearing here. But just give me kind of your 100,000-foot argument for why we should not do what Congress is proposing to do.
Yeah, so I think we're always talking about the number of Arkansans that rely on Medicaid. So we've got about 800,000 Arkansans that utilize Medicaid. This, and a small estimate says it's going to kick off at least 100,000 people. We should be concerned about that. Hospitals have already raised the alarm. They've already said they're operating on razor-thin margins, and this will lead to more individuals showing up needing care that don't have insurance.
Yeah.
And so
they're uninsured. They have to go in and get uncompensated care. The hospitals do not get reimbursed for taking care of them.
Exactly.
They're mandated to. Exactly.
That was something that we saw a lot of before Arkansas chose to expand Medicaid. And so we solved that with Medicaid expansion. Now we're really close to being right back in the same problematic area.
So here's, your position's very established on this, and so I want to kind of go beyond that. I hear the congressman, I interview the congressman from our delegation, I see this nationally as well. They don't believe that the Congressional Budget Office estimates are accurate.
Right.
They've been off before, sometimes they're right, sometimes they're wrong. Who are we supposed to trust on the estimates for what a congressional bill does, if not the CBO? Is there somebody else out there that we rely on?
I mean, I think, the Congressional Budget Office, it was specifically set up so that it didn't come into partisan views and things of that nature. There's a lot of estimates out there. I can show you 20. I'm sure individuals that view more conservative can equally show you. But CBO is the entity that provides those details. And so they're saying, I think you've seen the numbers. They're saying that it could raise our national debt in the, 2.4 trillion number.
Correct.
What I would ask, our members who say they don't believe in CBO is, well, what numbers are you seeing and where are you getting those numbers from? Because right now, there is no other estimate that says that this will make our deficit go down.
I can tell you the answer I get when I ask that question is, I don't have another place that I'm getting it from, but I'm just telling you instinctively I don't believe that number.
Yeah,
and that's really what the decision is being made on. So
when you're concerned about data, that's scary.
Yeah.
So.
All right, well, another claim that we have heard is about how the work requirement will change, shore up the strength of the Medicaid program for the people that truly need it. We want to put able-bodied people, not allow them to have Medicaid. They need to be working at least if they're going to receive it. We've tried this in Arkansas before, and there's a second effort to do it, which is different than the first one. How do you think it will? I expect us to get the waiver. How do you expect it to work in Arkansas this second time around?
And Roby, I worked at Department of Human Services. I was a deputy there for a long time. I was there when we implemented work requirements the first time.
Did you believe it would work?
I thought that it would help, and I saw firsthand that it didn't. And so this is the problem with work requirements in general. Number one, the majority of Arkansans that are on Medicaid or utilize SNAP that can work, do work. One of the things that we weren't thinking about at DHS at the time is not whether or not someone wants to work, it's whether or not they have a job available to work. And so the real problem with work requirements is that we don't first look at whether or not there is availability of quality jobs that will no longer make these individuals eligible for Medicaid, right? If the only job available is McDonald's, then that individual is going to be working those jobs and probably still qualify for Medicaid, but now have to go through all of these, extra efforts, reporting efforts, which tends to kick people off of Medicaid.
Do you think the reporting requirements this second time around are improved from the first time around? There seems to be a different take on this.
You know, I think we'll have to see. It depends on what systems the department is using. If they're using the same systems that were previously used, there were errors. There were problems. Technology doesn't easily talk to one another, and it was leading to individuals being kicked off. I mean, we saw that in the state being sued over the work requirement program. It was about the fact that technology did not do what we needed it to do.
You mentioned SNAP earlier. SNAP's another thing on the chopping block at the federal level, really to push states into paying for more of it, picking up more of the tab. It's 100% paid for, except for, I think, administrative costs, which are 50-50 right now.
They're 50-50, yeah.
So you're looking at pushing significant money back to the states, basically an unfunded mandate of sorts, which we love here in Arkansas. But again, what do you predict will happen if this goes through as it's kind of currently written and being debated?
We're talking a lot about Medicaid. SNAP is just as big of a concern, because you pointed that out. On the House side, their proposal would make Arkansas responsible for $110 million in costs that we have not paid before. The Senate side is a little better. It's $55 million. But the question, Roby, is where is that $55 million? Do we have that sitting somewhere in the bank? And we don't. Our state legislature and our governor is going to have to sit down and figure out how we are going to pay this. And if we can't, because the bills don't provide any provision for us to make SNAP payments lower or anything like that. So if we can't pay the $55 million, then the only other option is to not have a SNAP program. And I know that people think that that's just unbelievable, but these requirements are harsh and they're new, and there's not a lot of wiggle room in them to help states pay those funds.
The state got a waiver in the recent week to push the SNAP program to ban soft drinks, candy, so in an effort to be more healthy.
Yeah.
Do you find that problematic? I mean, I've seen some pushback from the soft drink industry.
Right.
Shocker there.
Yeah.
But I mean, I'm not deeply involved in the SNAP program, so I don't know how the rubber meets the road on this.
Yeah.
It seems logical when somebody explains it to me.
I'm not in the business of thinking that. I think one of the things, Roby, is that we have to think about when people are on safety net programs, it's typically one of the hardest times in their lives. And so I don't believe in policing people and saying you can't buy this and you can't buy that. I also don't think that by banning it, we're going to magically become a healthier state, because just like Medicaid recipients, SNAP recipients work. So they probably have the funds available to just pay cash for the candy bars and the sodas. So if we want to ban them, then we're banning them. But I do not believe that by banning them, that all of a sudden we're going to be a healthier state.
All right, let's shift gears and talk about the kids count data that comes out annually. You guys are part of that network that promotes the findings there. It's very data driven. We saw Arkansas actually improve in education in terms of our state rankings, but if you look at the numbers, we were kind of down in 3 of the 4 categories. I'm trying to figure out how that happened. Did all the other states just do even worse? I mean, I'm asking that kind of honestly.
The education numbers are a little hard to understand, specifically because we didn't improve in reading. We're not improving in our math scores, but yet it's saying that we're graduating more children on time, which is really what led to our increase. It's really hard to understand. We're trying to digest the raw data, because it does look like maybe states did poorer in those areas as to what led to our increase, because unfortunately in almost all of the other areas we are doing worse, and we kind of evened out and we ranked 45th, which is the same thing we ranked last time.
This is lagging data. We got about 30 seconds left. This is lagging data. So do some of the changes that we've seen in the most recent legislative session, or even the session before, we really haven't caught up and seen those new policies have effects yet?
We have not, and we definitely hope so. So this ranking is really based on the year right after the pandemic. So we're still dealing with those numbers. So we knew that they would be poor because of the impact of the pandemic. The hope is that the things that the legislature have done, especially around education, the increasing in the per pupil funding, what LEARNS did pertaining to tutors, we're hoping that that will increase the reading skills of our third graders, and we'll see improvement.
All right, Keesa Smith-Brantley, she's the Executive Director of Arkansas Advocates for Children and Families. Good to see you as always. Thank you for being here.
Always great to see you. Thank
All right.
you.